In terms of mental health, again, if we want to care for our patient with MCI or with dementia, it's very important that we understand the diagnosis and the stage of the disease. If the person is in the early stages, it is hugely important that we make use of sensory stimulation. And of course, if the person is in the later stage of the dementia, we may actually just go for palliative care. Treatment of depression and anxiety, again, something that Dr. Kutzer touched on, which is vitally important in order for the person to have quality of life. If the person is sad and tearful and suffers from a clinical depression and or severe anxiety, the person can't have quality of life. And therefore, it's important that those are addressed. The person perhaps consults the correct specialist for this to be addressed and treated. Psychological difficulties, another important aspect. So again, depression, anxiety, fear. In many of the patients that we assess in the community to determine whether the person perhaps is showing signs of developing dementia and or MCI, we often see they often have a sense that something is wrong, but they don't know actually what. And then there's often denial. There's nothing wrong with me. I'm fine. Loss and grief, often of a spouse, and things like an anniversary reaction, so the actual annual date where the person suffered severe trauma in the past, has a large impact on the person's psychological health or difficulty or what they struggle with, that brings on tearfulness and depression. And the role of a psychologist here can be extremely important.